Well, hello, everyone. It's always interesting to hear your voice on a mic. I am introducing today, as John said, the Privacy Toolkit that we've been working on. We've been working on this project for the past year, so I'm really excited to introduce it with you. I've been working on it with Woody, who's going to be coming up behind me. He is the Director of Design at Sage. So I am lucky to work with John and Meg on the governance team. I'm a research scientist as well, and I specifically look at outreach and engagement, and this was an interesting work on using kind of some of the participant feedback that we've been hearing, both in the user research, also in the informed consent as well, and then talking about privacy in a meaningful way to participants. So as I walk you through this talk, I'm going to talk to you about why we did this deep dive on privacy. Also, I'm going to talk about the purpose of the toolkit, the journey of creating the toolkit. The toolkit is to share the best practices and design patterns to help biomedical researchers engage with research participants on privacy. So I probably don't have to deal too much about the current climate. As we all know, privacy is a very hot topic in tech right now. You only need to look at the New York Times and the Washington Post. They're all doing extensive coverage on privacy and tech. And unfortunately, there's not a lot of solutions out there. And if we look in the biomedical sphere, there's not a lot of solutions and there's not a lot of talk. So we wanted to start that discussion. In this age of continuous data breaches, people are really concerned about their data privacy, their security, and it's rightly so. They're worried about their sensitive data, like financial information and health information, getting into the wrong hands. And as we kind of know, once data breach occurs, the cat's out of the bag. You know, your data's out there, it just matters on who's going to use it. The mobile health sphere is not immune to this at all. For mobile health research studies to be successful, biomedical researchers and their teams need to meet these concerns head on. So in the health space, we're experiencing a new form of violation of ethics and the loss of confidentiality in the release of sensitive health information. One such headline, as we can see, is the data scraping that occurred on the Patients Like Me website. The Nielsen company saw the Patients Like Me website, which is an interactive website where patients can go to talk about their medications, ask questions. It's kind of a community-based website. They saw this as the perfect opportunity to gather data from unknowing participants on their disease progression and medications and sell this data to pharmaceutical companies so that they can make targeted marketing ads. So you're probably asking this question, but how does this really affect my research? So I'm going to kind of walk into this worst case scenario with you with a little bit of a diagram, or a storyboard as they're called. So we look at this storyboard of a participant who's interested in participating in a chronic disease study. He finds out that he hears about this study, he suffers from this disease, he wants to participate, he wants to give back. So he checks out the website, he checks out the app. They don't really deal with a lot of his concerns around data privacy and sensitive information. This is a chronic disease he has. He wants to share this information, but he doesn't want everyone to have this information about him. So even though he wants to be part of the study, he's kind of putting it to the side that he really does have some major privacy concerns. He reluctantly decides, okay, I'm going to go ahead, I'm going to be part of this study, I'm going to sign up for the study. But as he's sharing this information and they're collecting this information from him, he's still in the back of his mind worrying about where is this information going. And then at the end of the day, that worry becomes bigger and bigger, and he decides to delete the app, end his participation in the study, and he's no longer a participant. This is a horrible circumstance for a researcher because we've lost quality data from a participant, but as we all know, in recruitment, it's still word of mouth. So we also lost a very important spokesperson who could possibly engage other people that they know that have this chronic disease into deciding to be participants in this study as well. So what do we have to guide us? Talking on Andrea's talk on regulation, we have this piecemeal regulation that kind of provides some guidance, kind of doesn't provide some guidance. As we know, we have HIPAA, which then provides guidance to healthcare providers and covered entities, but doesn't provide guidance to people in this unregulated field. Then we have, there's COPA for children, then we have some on family education rights, which is more in the education field. The states are now getting into regulating, so we have California coming up with their own privacy laws. So there's this huge piecemeal system of regulation on data privacy, and it doesn't all connect. Now we have GDPR if you want to do an international study, so you kind of have to dodge your bullets when you're looking at regulation. But we do have some guiding ethical principles. So the Belmont report lays out these principles. First, we have respect for persons. So as Meg touched on, participants have the right to make an informed decision on participating in research without being coerced. Studies should maximize the benefit and minimize the harm to participants. Do not harm. We also have this idea around equity as well, of being equitable. Researchers should consider the costs and the risks to potential participants, and these risks should be administered in a fair basis. Researchers should not exploit vulnerable populations or communities for the sake of research. But we also need to think of privacy as another component of these ethical and guiding principles. We should be telling people what we are going to do, and we should also be telling them what they don't already know. One of the things that we heard in a lot of the interviews was if you present a privacy policy to someone or you present information to someone on a research study, they always want to know, what else are you doing that you're not telling me about? So privacy is really just another form of respect to these participants. So we need to do more, but where do we start? We have, the regulation that requires informed consent. We also have the privacy policy piece as well, and that's kind of the drop-off. We don't really talk about privacy again once they start using our application or join our study. We're just like, well, you bought into it. Thanks for helping us. But we can do more than that. There's definitely multiple touch points throughout the entire journey of the study where we can reiterate information on privacy and we can explain to participants what we're doing with their data. So how did we get into this? I will start off in saying that when I presented this project to Christine and John, I presented as, I'm going to make a more engaging privacy policy, and I'm going to do this with design. That, of course, when you meet a designer and a researcher and you combine them together, ends up being a project that's much more bigger in just being an engaging privacy policy. We decided to do a little bit more than that. So we took a step back, and before we decided to actually create the tool that we created, we started to do some interviews, and we created this formative research that kind of was the backbone of this project. We conducted 15 one-on-one interviews. And these interviews started off with questions, just basic questions around privacy. How do you feel about sharing your information? How do you kind of weigh the risks and benefits of sharing your information with an entity? And then we walked them through some scenarios to see how they kind of go through this risk and benefit analysis when they're deciding to share their data, whether it be with their grocery store or whether it not be with an actual mHealth app. So one of the first ones the scenarios that we introduced to them was the grocery store rewards program, which is a pretty frequently used program. A lot of grocery stores now have these programs where you essentially sign up for the program and you'll get a discount on your groceries. This is also how the grocery store kind of tracks your purchases so that they can do more targeted marketing to you. And most people were like, yeah, I would sign up for it, especially if I'm in line because it's an easy program. I'll get a discount on my groceries. The benefit seems something that's in real time, I get right away, and the risks seem pretty minimal. After that, we walked them through the scenario of signing up for an electronic medical record patient portal. And that was an interesting one because we basically said, for you to interact with your doctor, you would sign up for this patient portal. You'd be able to see your healthcare records, you'd be able to ask questions of your doctor, make an appointment, but then it also gives anyone in that system access to your medical records. And people have an interesting response to that. They didn't even really weigh the risks at all because to them, the benefit of interacting with their healthcare provider in real time is just such a huge benefit that they're just like, I can't even weigh the risk against it. Also, most people couldn't remember how they interacted with their doctor before the patient portal, which I found a little surprising. It's always interesting when you're doing user interviews because you want to be like, don't you remember when you had a telephone call and they would send you results, maybe in the mail, and they're like, there's just like no recollection of what life was like before patient portal. And then the last scenario was actually doing an mobile health app. It was one around physical activity. So people would share information about their logistical information. And then they would also share information about their food intake and do that by sharing pictures on their phone. A lot of people felt like that was crossing the line because if they shared access to all of their pictures, there might be pictures on there that they don't want other people to see. So a lot of people, that was a more iffy scenario for them. So we found that the 15 interviews fell into these three groups. The group with no agency felt like they had no choice in the matter of sharing their data. The benefits outweighed the risks in sharing their data. Then there's this middle group, apathetic, where they felt like their data is already out there. Most likely it's already been compromised at some point, so there's really nothing they can do at this point. And then there was the third group of people who really take their data and their information, they take it as being very important to them, and they also feel like they have agency of whether or not they can decide to share this data with other people. We want to move people from this no agency and apathetic group into this idea of agency, making sure that they are looking at the information and creating a trusted partnership with whoever they're sharing their data with. So in deciding to create a tool, we first came up with this emotional value statement. So Sage's privacy tools will give users agency and transparency of what they share, in turn fostering a trusted relationship between our researchers and study participants and users. Then we took our own apps and we kind of documented, we did a journey mapping where we would document every single touch point we had with the participants where they would share data with us or had some kind of interaction around privacy. So we knew exactly where we would institute some of these design patterns to have real impact and meaningful interaction with the participants. And then we tested some of these design patterns that we created for the toolkit with the researchers we had in-house. I'm sure many of our researchers were pretty sick of us asking us questions about privacy, and we were always iterating with them that privacy is really important, and they're like, we get it, we understand privacy is important. They also brought up really good points in the fact that often when they're developing apps or developing apps for research studies, they don't have this whole gamut of options available to them. They may not have the feasibility of having a designer on their team. They may not have the feasibility of even having an engineer on their team. And sometimes they need help with they need someone to do kind of the background knowledge and create these design patterns so that they know when to institute them, they know what to do with them, and they need this knowledge to be shared with them. So we reflected on a lot of the interviews and the information we created, we reiterated on it and defined it, and this is what is the creation of our privacy toolkit. So we tested, with the testing that we did with the internal researchers, we changed a lot of our tone so that we weren't these nagging people telling you privacy is so important, privacy is so important. We actually created, the toolkit is kind of created a lot of the design patterns, really set up a case of why they're important. So we talk about what the worst case scenario would be of not using a privacy, the best practice of people either not being retained or not even participating in the study. And then we share with them both our designs and our code so that they can use these best practices in their own work. So this is just a snapshot of the Privacy Toolkit. The Privacy Toolkit is a website that we've created sharing all of these patterns. We've broken them down to specific components throughout the entire journey of the study. So whether or not you're engaging with people on your website, just getting the word about your study, or taking it all the way through to the end of the study if you're doing a mobile health app. This is very much a living and breathing system, so we're hoping, we have shared our best practices. We're hoping other people who are also doing, work in this design space will also share theirs with ours, and we'll review those patterns and also share them on the website. So we're hoping to build a community around improving data privacy. So I'm just going to highlight one of the patterns on the website right now, and that's the privacy policy pattern. So the privacy policy pattern talks about some of the design functions you can do to make it more transparent and allow people to really understand what's going on in the study. As we learned in the interviews, no one reads a privacy policy, which is alarming, but not too surprising. But there very much is, tips that you can do in the design and the content, which Meg talked about in readability, of making things easy for people to find, not making the privacy policy like embedded in the footer in small type, actually making the link apparent to people of where it should be. And then also, making the language readable, making the headlines transparent about what kind of content will be in there. And then also, after you draft your privacy policy, talking to the engineers on your team and making sure that this is actually doable on their end. I did this with 2 of the engineers at Sage, and after meeting with them, they were both very surprised because they had never read the privacy policies at Sage. And they were like, I've never read these before, so it's really good you're asking about it. And then one of the engineers actually noted at the end of the meeting was that he thought all privacy policies were wrote by computers, and that he was really surprised to know that I was not a computer. And I was like, that's great. So yes, they are written by real people, and there is a lot of ways to improve privacy policies. We also provide, helpful tips of how you can prepare your privacy policy and some resources that you can go to. We link to the elements of informed consent, another toolkit that we have at Sage, also, and other privacy policies that we have thought are done well. You don't need a huge budget to make a privacy policy. Yes, Google uses videos, but you can use icons. You can use layered approaches of truncating the information so it's easy to find. So there's definitely things that you do to improve this process. So where can you find the Privacy Toolkit? Well, the Privacy Toolkit is live now. This is the website for it. There is patterns that we have already put up there. There's some that are coming soon. We're going to add patterns as we, grow out this toolkit, and hopefully we'll have other patterns from other people that are contributing in this field. So feel free to check it out to give your perspective on it. And I would like to thank all the contributors. We had, the great part about Sage is that we can work within our teams. And this was definitely an exchange of ideas from all the different teams. So we were great to work with all these different people at Sage and outside of Sage, and then also some of the inspirations in creating this kit.